Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Dangerous heart rate. Understanding your levels. Generally, a dangerous heart rate for an adult is above 100 beats per minute, BPM, at rest or less than 60 BPM at rest. However, some individuals may experience slight variations in these heart rates. For example, fit individuals may have resting heart rates below 60 BPM. /r/n/r/n Many factors determine whether a heart rate is dangerous, such as a person's activity level, age, gender, and any underlying health problems or medications they take. A dangerous heart rate for a child can also vary significantly depending on their age. /r/n/r/n Illustration by Julie Bang for Verywell Health /r/n/r/n A heart rate may signal an underlying health concern when the resting heart rate is above 100 BPM or under 60 BPM. A heart rate that is above 100 BPM and too fast is called tachycardia. A heart rate that is too slow and below 60 BPM is called bradycardia. /r/n/r/n When you're active during the day or exercising, your heart pumps faster to get oxygen to your muscles. This makes your heart rate go up. At night, when your body is at rest, your heart rate tends to go down. So, there are times during the day when it might be okay for your heart rate to go below 60 BPM or beyond 100 BPM. And if you're an athlete, your resting heart rate may be below 60 BPM. /r/n/r/n There can be some variation between male and female hearts, and females tend to have a higher resting heart rate. However, if you are assigned female at birth, a resting heart rate above 100 BPM still warrants a call to your healthcare provider to check out potential underlying causes. /r/n/r/n The thresholds for a dangerous heart rate at rest or a maximum heart rate when active depend on your overall health, age, fitness level, and any medical conditions you have or medications you take. Higher heart rates are expected when active and exercising, but they should return to between 60 and 100 BPM at rest. If it doesn't, check in with your healthcare provider. /r/n/r/n Generally, your maximum heart rate is about 220 minus your age. So, if you are 40 years old, your maximum heart rate while exercising would be 220 to 40 equals 180 BPM. While a heart rate of 180 may be safe during periods of vigorous exercise, it should not remain that high. /r/n/r/n While moderately exercising, your target heart rate should be 50 to 70% of your maximum heart rate. So, if you're 40 years old, your maximum heart rate should be about 180 BPM, and your target heart rate should be between 90 and 126 BPM during moderate exercise. If you exercise vigorously, your heart rate may approach 85% of your maximum heart rate. /r/n/r/n However, once you are done exercising, your heart rate should fall back below 100 BPM at rest. If you exercise regularly, a resting heart rate of 40 beats per minute might be normal for you. /r/n/r/n A heart rate that's too high is calledtachycardia. In general, tachycardia means having a sustained heart rate above 100 BPM. /r/n/r/n There are different types of tachycardia, including /r/n/r/n A higher heart rate can be normal in some situations, such as while exercising. You can also get tachycardia, /r/n/r/n Too fast heart rates reduce the heart's ability to pump blood throughout the body effectively and can lead to other health problems. /r/n/r/n In some cases, tachycardia does not cause any symptoms. When it does, a high heart rate can cause symptoms like /r/n/r/n Some of these symptoms are also symptoms of serious medical conditions such as a heart attack. Seek medical care if you are experiencing chest pain, difficulty breathing, or are concerned. /r/n/r/n There are several causes of a high heart rate. These include, but are not limited to, /r/n/r/n Your heart rate generally decreases while you sleep. If you notice that it increases during sleep, it can signal sleep apnea or another underlying cause. /r/n/r/n If a problem like a dangerous arrhythmia is causing a high heart rate, it can be fatal and possibly occur without warning. /r/n/r/n There are a few strategies you can use to calm a racing heart. However, know that if there is an underlying health problem causing your heart rate to be too fast, you might need medical treatment. /r/n/r/n You try to lower your heart rate by /r/n/r/n A heart rate that is considered too low is calledbradycardia. For adults, this typically means a heart rate lower than 60 bpm. However, athletes and fit individuals can have low resting heart rates. /r/n/r/n There are different types of bradycardia. /r/n/r/n The symptoms of bradycardia are similar to those caused by a high heart rate and can include /r/n/r/n Causes of bradycardia can include, but are not limited to, /r/n/r/n There is no specific heart rate that is a sign you are having a heart attack. A person's heart rate can be higher or lower than normal if they're having a heart attack. /r/n/r/n To measure your heart rate, place your index and middle fingers at the side of your neck or the inside of your wrist and count the number of beats, pulses, for 1 minute. Alternatively, you can take your pulse for 15 seconds and multiply it by 4. Many devices such as wearable fitness trackers and smartwatches can also measure your heart rate and help you track it over time. /r/n/r/n Keep in mind that if you take your heart rate when you're stressed, ill, have recently used substances like nicotine and caffeine, or were recently working out, your heart rate might be higher than its usual baseline. /r/n/r/n If your heart rate is consistently out of the normal range or you are concerned about your heart function or that of your child, contact your healthcare provider. /r/n/r/n Your healthcare provider can perform various tests to determine if your heart rate is too high or too low and the underlying cause. /r/n/r/n Sometimes, a change in your heart rate can signal a serious health problem. /r/n/r/n Seek immediate medical attention or call 911 if you get any of these symptoms suddenly and severely. /r/n/r/n Healthcare providers can use various tests to determine the underlying cause of abnormal heart rates. These tests include, but are not limited to, /r/n/r/n Tell your provider about any medications, over-the-counter, OTC, products, or supplements you are taking, as certain drugs affect your heart rate. For example, beta blockers slow your heart down, while decongestants can increase it. /r/n/r/n Normal active and resting heart rates differ among children and adults, and the normal range for heart rates in children varies depending on age. Many causes of fast and slow heart rates are the same for children and adults, such as illness, fevers, infections, medications, cardiac conditions, and other health concerns. /r/n/r/n If you are concerned that your child's heart rate is too fast or too slow, ask their healthcare provider for advice. /r/n/r/n A normal resting heart rate for adults is 60 to 100 bpm. However, heart rates can vary from person to person, and your ideal heart rate might be higher or lower than this range. /r/n/r/n Many factors can cause a heart rate to be too high or too low, including exercising, consuming caffeine, and smoking. In some cases, a heart rate that is too high or too low is a sign of underlying problems with the electrical impulses in your heart, other medical conditions, or even a side effect of a medication you're taking. /r/n/r/n if you have an abnormal heartbeat and other symptoms like chest pain and shortness of breath, seek medical attention. /r/n/n/r/n/r/n/r/n thank you. Form.email, for signing up. /r/n/r/n there was an error. Please try again. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.